Hello, my name is Connie Johnstone. I'm a senior nursing student at Pacific Lutheran University. I did my preceptorship at St. Francis in an outpatient surgical unit in Federal Way, Washington. I spent most of my time in the pre-op post-op area. My main job was to help patients get ready for surgery and then take care of them after surgery, making sure that they were ready to go home. My capstone project is called Nursing Care of the Postoperative Inguinal Hernia Patient in Ambulatory Setting. A hernia is a bulge of your intestines that pass into a weakened area of your abdomen. I picked inguinal hernia surgery for my topic because I found it to be one of my most challenging types of patients this last semester. Hernia patients are difficult to get moving because of pain and prolonged anesthesia effects. They're also often unable to urinate right away, which is a priority before they're able to leave the hospital. I spent a lot of time and care for these patients. After researching hernias, I was surprised to learn that they are one of the most common types of surgeries and that more than 20 million operations are performed yearly worldwide. 1 in 4 men will have hernia surgery in their lifetime. Inguinal hernias can be direct, passing through a weak point in the abdomen area, or indirect, most common in men, passing into the inguinal canal and dropping into the scrotum. If you look at the top of my poster, I've included a few pictures that demonstrate the difference. I remember learning a lot about hernias in med-surg class. I know that you don't always need to have surgery to have a repair done, but I didn't realize was that this can be done in the office, in the doctor's office, like as an office visit. The provider may be able to manipulate the intestines back into the abdomen with just a little pressure of their hand. I'm just going to go over some common signs and symptoms. So for a hernia, it's a bulge in the groin area, burning pain that increases with coughing or sneezing, and swelling in testicles of men. On assessment of the postoperative patient, you would check each body system carefully due to the effects of anesthesia. The plan for these patients is to alleviate pain and encourage activity and mobility as permitted. One key thing to remember, discharge planning and education starts when the patient arrives at the hospital. Some nursing interventions will include ensuring adequate body systems, keeping the patient hydrated, preventing falls, managing pain level, and encouraging urination and ambulation. The patient will be giving discharge instructions to teach them how to care for their surgical site, observe the site for infection, prevent injury, pneumonia, and constipation. The patient will need to have someone with them for the next 24 hours while the anesthesia wears off. You always want to make sure that the caretaker is present when you're giving the discharge instructions because the patients will still be under anesthesia effects. A few important takeaways from this project would be to keep a close eye on the patient's urinary and respiratory status. Anesthesia can cause respiratory depression requiring oxygen, or the patient might need a urinary catheter due to urinary retention. I've seen both of these scenarios during my preceptorship. One of the most critical nursing interventions will be keeping the patient hydrated. This keeps their acid base balanced, maintains adequate blood pressure, keeps them so that they can urinate and have a bowel movement without straining. Straining can cause the surgical site to reopen. Preventing pneumonia is also vital for all surgical and hospital patients. We teach all of our patients to do deep breathing exercises by coughing to clear their throats, and we teach them how to use an incentive spirometry. Patients with abdominal surgeries must not cough. Coughing can cause the surgical site to reopen. We need to teach our patients to splint their abdomens with a pillow if they have to cough or sneeze. On a closing note, the key to quick healing patient is early ambulation. Getting your patient up and moving will get their body system moving too, allowing them out of the hospital and into the comfort of their own home. I would like to acknowledge my preceptor, Cheryl Obert, and the nursing faculty at St. Francis Ambulatory Surgery Center for taking me under their wing and sharing their knowledge. Also, special thanks to all of my peers and professors at Pacific Lutheran for their support and encouragement.